Good evening, doctor. Thank you so much for joining me here today. Today, I wish to discuss on the topic of the effect that COVID had on the mental health of people, the post-COVID crisis. So, before we begin, can we know a little bit about you, please?
Well, thank you very much, Priyal. I am Dr. Bhainder Singh. I'm working in a government hospital as a homeopath. And as you asked, COVID had a widespread effect on the psyche of the people. It affected people mentally, physically, emotionally, uh, even financially. And people lost their jobs, people lost their business, and people exhausted their savings. So it had quite a widespread of effect. And there was a whole and aura of insecurity, anxiety, fear, and at times panic. People were compulsively washing their hands, and they were compulsively using all the sanitary measures. So it just added to the stress. So it had a big general and a widespread effect.
Yes, the COVID times were indeed very scary. How did the social isolation and lockdown measures, how did they affect people's mental health?
Well, we know man is we humans are social animals. We thrive in communities. We thrive with families, with friends, with colleagues. And then getting isolated, it sent a feeling of getting entrapped, getting encased, claustrophobic, getting narrowed down in a space. So it added to the agony. So isolation had big time effect.
Yes, sir. What coping mechanisms did people use to escape from this stress and the mental health isolation?
There were various ways. Every person uses its own way, but the socializing, social media was the biggest outlet. People started enrolling themselves to new courses. They started learning new skills. They started using more of social platforms and introspecting and working on their health. These were few measures people tried to cope at that times.
Yes, doctor. And what roles can or did the government play and the communities play in helping people escape from this crisis, or maybe they did when COVID was going on?
Uh, well, governments, they always have a big role because the whole system is in their hands, and governments need to be prepared because uh, infectious disease, they had been always the biggest killer on this planet, even more than all the world wars. So in the coming times too, we are going to face such situations, bigger or smaller than this. Government should be prepared. They should uh, prepare the masses. They should encourage people, educate people to talk about their mental health and various such measures. They can advertise, they can organize seminars, classes and all.
That is great advice, sir. And like you said, that it is even dangerous in World War. And if any more diseases like this come up in the future times, what should people do to build resilience to such diseases, to help them take care of themselves if something like this comes up again?
Well, the only way to, I mean, shield ourselves from any disease is that raising your immunity, and all the measures. Stress is the biggest factor which drains immunity. We should apply all the measures like exercising, doing yoga, and various other exercises. Then the importance of hydrating ourselves, drinking ample of water, the importance of natural sunlight, and then above all, the importance of 8 hour sleep. We all are deprived of all these basic things. I think if we set these basics right, definitely they'll help us in the long run.
Yes, doctor. Thank you so much. We will make sure to keep ourselves hydrated and have good 8 hours of sleep. This session has been very insightful, and I thank you very much for taking out your time to join me.
One more thing, being a homeopath, I like to add that
Yes,
using the holistic systems of medicine, the alternative system of medicine like yoga and homeopathy, they too have, along with allopathy, they too have a big role to play, and people can take help and from these alternative systems as well.
yes, doctor.
Thank you
We
very
will
much.
keep that in mind. Thank you so much.